Yeah, I think there's something to say about that sense of community. I grew up on a farm in country Victoria, and remember one of the lasting memories I had was when there was a bushfire in the back of our property, and in no time there was dozens and dozens of people descending on our property to all fight the bushfire, and there were people going up and volunteering to actually fight the fire, but also there were plenty of people there to, the ladies who were making the morning tea and all that sort of stuff to keep everyone fed. And I think that when there's adversity, you really notice that community. Is that something that you've experienced, Liv, or seen, witnessed?
Well, I think you can see it in rural communities, particularly in healthcare. It was touched on this morning with the ambulance service, and a huge number of ambulances are propped up by very hard-working volunteers who dedicate their time to really help their communities. I mean, I think a lot of healthcare, there are volunteers across all sort of parts of it that play a very vital role in our community. But I think you're right about that sort of connectivity, and we all need very close family friends, but also we need a lot of other sort of smaller connections in our day-to-day lives. And sometimes I think modern life is trying to erase them, self-checkout at our supermarkets, never having to interact with anyone, travelling-wise sometimes. But rural communities still have a lot of that, and you go to your local IJ supermarket and you know the person at the checkout. You've got a relationship with your local pharmacist who knows your family setup. And those things, even though they seem kind of minor, they're actually incredibly important for the health of our communities. And Tassie has that, and we really need to make sure that stays. Yeah,
okay. So you sort of touched on it there, but how important is access to good health care, Elizabeth, in terms of what you've seen in your work?
I think it's incredibly important. So I've worked in a number of places across the state. I've worked in Smithton before, and I've done a lot of locuming across regional Victoria. And I think you can't have a healthy regional community without good access to medical care. Even recently I was speaking to a couple in their 70s who live in the northeast of the state, and they've had a number of health incidents where they couldn't get an ambulance in time. They can't get in to see their GP for 6 weeks, and they were shocked by it. And I think there's a lot of fear and worry in rural communities that they realise now if something happens to them, they may not be able to get the care they need. And that's very worrying. So I think we can't have healthy communities without good medical care. We're in crisis now. It's not something that's about to happen, and we'll all see the effects of it. And I think none of us are immune from it. Like, it'll be your mum who sits in emergency for 36 hours because there isn't a bed, to be your neighbour who can't get a scope for a year for their bowel cancer, which could be then, have metastasised, your dad in a nursing home who can't get a GP to look after them. So we're all going to be affected by this.
Yeah, you're a bit of a rare career path in terms of young doctors these days. What is it, Tim, the stats now in terms of the number of GPs or young doctors becoming GPs?
Yes, so a recent study of the medical graduates, only 13% were going to choose general practice. So back in my day, and I'm getting a bit long in the tooth, but it was 40% of people. So we need it to be a lot more than 13, and it's even worse the further you get away from the GPO. So, and we know some things we can do to fix that. One is get medical students from rural situations. It's a bit like I was saying myself, and they're more likely to go back to the country. Give medical students good training in rural practices, and they're more likely to come back to rural training. And we're looking at asking the government to reintroduce GP terms for young doctors in the hospital system when they're doing their rotations through paediatrics, surgery, maternity. They also do a GP term, and we know that if that happens, one thing there'll be already an extra someone to see in the surgery, but long term, those people are more likely to do GP trainings to get that 13% up to more towards 40.